Hello, my name is Carla Cueva and I'm going to talk about effect of PCI on long-term survival in patients with stable ischemic heart disease. Definition: percutaneous coronary intervention (PCI) relieves angina in patients with stable ischemic heart disease, but clinical trials have not shown that it improves survival. Between June 1999 and January 2004, it was randomly assigned 2,287 patients with stable ischemic heart disease to an initial management strategy of optimal medical therapy alone, medical therapy group, or optical medical therapy plus PCI, the PCI group, and did not find a significant difference in the rate of survival during a median follow-up of 4.6 years, with no reported rate of survival among the patients who were followed for up to 15 years.
Coronary artery disease is narrowing of the coronary arteries secondary to several risk factors, some of which are cigarette smoking, hypertension, hyperlipidemia, and diabetes. Percutaneous coronary intervention, or PCI, is a procedure used to treat and evaluate partially and completely occluded coronary vessels. Atherosclerosis results from endothelial injury, inflammation, and accumulation of lipoprotein, leading to endomal deposition of particles and narrowing of the coronary artery. The stenotic vessel makes it difficult for red blood cells to pass through. Therefore, the risk of ischemia and infarction is increased. During a percutaneous coronary intervention, an incision is made to isolate the femoral artery. A catheter is inserted into the artery and guided up the aorta to the heart. Live angiography is used to guide the catheter to the obstructed coronary artery. Radiopaque dye is injected into the artery. Imaging determines the location of the stenosis and the diameter of the vessel. Once the vessel is isolated and the obstruction located, a guide wire is threaded through the catheter to the location. The catheter is removed, leaving the guide wire. A balloon catheter is pushed over the guide wire and centered over the blockage. The balloon is inflated to open the narrowed vessel. The balloon is inflated and deflated multiple times to gradually widen the occluded vessel. To ensure that the artery remains unobstructed, a second balloon catheter with a stent is threaded to the location. The balloon is inflated, expanding the stent. For some patients, drug-eluting stents are used to decrease the chances of in-stent stenosis. Drug-eluting stents are coated with a material that will retard new intimal hyperplasia. Blood flow through the coronary artery is restored.
Application in medicine. Pharmacologic and lifestyle interventions consist with existing clinical practice guidelines were applied equally in the two treatment groups. The cardiac risk factor goals in the COURAGE trial initially include a non-treatment low-density lipoprotein cholesterol goal between 60 and 85 milligrams per deciliter. Lifestyle counseling included strategies for smoking cessation and advice of exercise, nutrition, and weight control. PCI was performed according to the judgment of the operator and prevailing-based practice. We used the Kaplan-Meier method to estimate the cumulative death rate and the stratified long-run statistics to assess the efficacy of PCI as compared with medical therapy.
Percutaneous intervention, or PCI, is a procedure where we go and fix the blockages in the coronary arteries or the arteries of the leg. We access the heart, usually from the groin or from the radial artery in the hand. Then we place a plastic tube which goes all the way to the artery and then fix the blockage. To prepare for PCI, we basically tell the patients not to eat or drink anything after midnight. If patients are on blood pressure medication or other heart medication, they can continue them. If they are on any diabetic medication, we tell them to reduce the dose by half. Percutaneous intervention, or PCI, is performed just like heart cath. We access the heart either from the groin or from the radial artery. A plastic tube is passed, which is placed at the entrance of the coronary arteries. And then, once we image the blockage, we try to open the blockage with the help of a balloon. Initially, a wire is passed, the wire goes through the blockage, and then a balloon opens the blockage. And then we insert a stent. A stent is something like a spring of a ballpoint pen. It is made of stainless steel, and then it keeps the artery open. The stents commonly come in two flavors. One is a drug-eluting stent, which has drug coating on the outside, and second is a non-drug-eluting stent. Depending on the nature of blockage, the length, and the size of the blockage, we can choose different kind of stents. A similar procedure can also be performed in the legs or in the kidney arteries. We go from the groin and then find the blockage in the leg and then open the blockage with a balloon, and if needed, we insert a stent.
Pros and cons. Pros. Observational data from large registry suggests that PCI provides a survival benefit among patients with coronary heart disease. A high rate of revasculation during the extended follow-up period will also reduce the likelihood of divergence in mortality between the two study groups. Cons. A total of 284 deaths, 25% occurred in the PCI group and 277, 24% in the medical therapy group. We observed that an initial strategy of PCI as compared with a strategy of medical therapy alone was not associated with lower mortality. The higher mortality among VA patients reflect a higher risk profile that include older age, male sex, and a higher frequency of the variables that predict mortality in a cost regression model.
My name is Ed Harlemert. I'm an interventional cardiologist at IU Health. The main type of patient we treat is a patient with vascular disease. Vascular disease is what we all know as a cholesterol problem. It starts at a young age in our bodies, but doesn't really become a problem until we reach middle age. But the development of cholesterol creates plaque, and the plaque grows to become a blockage. Percutaneous coronary intervention is simply the act by which a doctor unclogs your arteries. It's usually done through a series of tubes, larger tubes that go in the leg or the wrist, and then progressively smaller tubes with balloons on the end of them to help enter the artery and, with a simple inflation, unclog the artery. The duration of stay in the hospital is usually no longer than 24 hours, so you're in quickly and out quickly. You don't feel any ill effects from a surgery. You don't have any open incisions that have to heal. Coronary intervention, and specifically coronary angioplasty, has been performed since the 1980s. Around 1994, it became much safer to do angioplasty by using stents, and eventually then drug-coated stents, which has made the procedure highly successful. A procedure such as this now can be done with a success rate in excess of 95%. IU Health brings a vast network to be able to evaluate these patients statewide, and in the more complex cases, get them into the hands of a very experienced interventional cardiologist who is specialized specifically in the more difficult types of patients. I think that's the real advantage of IU Health.
Issue body neck error. Studies in echo reveals that myocardial infarction is one of the main causes of PCI within diseases including ACA. Refers that women have a coronary protective factor that accompanies them until menopause, a factor that is reflected in the age of onset of ACS. There is a significant difference in the age of onset of coronary artery disease, being of later onset in women than in men. The artery most affected among men was the right coronary, the anterior descending, and the circumflex artery, while in women were similar incidence between the right coronary, the left anterior descending, and then the circumflex artery, and the percentage of occlusion of the coronary arteries is higher in men than in women, may be related to the smaller diameter of the light of the arteries.
And they've been very, that's a STEMI, so we gotta go. Sorry guys. When that 911 calls, okay, now what happens?
There is a full appreciation that this is a potentially life-saving intervention.
I mean, there's all kinds of complications that you can have if you have a heart attack that's not treated appropriately.
Our community is supported by very proficient and professional EMS crews that arrive on the scene. They begin to assess the patient immediately, blood pressure, heart rate, O2 saturations.
Deep breath in and out.
We're having our ambulance crews do EKGs in the field, and they're interpreting the EKG, calling the emergency room doc, and the ED doc will make the decision to initiate the team.
Requesting entry note for a STEMI patient going to Beverly Hospital.
STEMI stands for ST segment elevation MI, and that's a specific type of heart attack.
So what do we have, guys? All this morning, Jay's having crushing chest pain.
Now that Beverly Hospital has the ability to perform an emergency angioplasty, there's no longer any delays involved with delayed recognition in the emergency room or transfer to another hospital. We can actually bring urban level care right to the community, the patient's own neighborhood.
Cath labs en route.
This is there because
Angioplasty is a procedure to open narrowed or blocked arteries caused by deposits of plaque. If the blockage is not major, the problem may be corrected by inflating the balloon several times to compact the plaque against the arterial wall, widening the passage for the blood to flow through. Typically, a device called a stent is placed within the coronary artery to keep the vessel open.
Percutaneous coronary intervention, also known as coronary angioplasty, opens narrowed coronary arteries. A catheter inserted in an artery in the groin or arm is threaded to the affected artery. A second catheter is then inserted inside the first one. When the catheter reaches the narrowed area, a balloon on its tip is inflated to reopen the artery. While the catheters are in the artery, a stent may be placed to prevent re-narrowing after an artery is widened.
Conclusion. We found that among patients with stable ischemic heart disease, objective evidence of ischemia, significant coronary artery disease, and a substantial risk of death, with mortality of approximately 4% per year, there was no difference in rate of long-term survival with an initial strategy of optical medical therapy plus PCI, as compared with optical medical therapy alone.